fresh, I rock well.
Good evening, ladies and gentlemen, and welcome to the CCA event. We have a packed house here, and welcome to everybody who's watching live streamed online. We're in for a really good evening. We've got a great panel of guests here, so let's get started. I'm going to introduce everybody. So first of all, we have to my right, Tricia Reed, who is the head pharmacist for Columbia Care. Let's hear it for Tricia. Okay, and then now to the left, we have Dr. Stephen Dahmer. Dr. Dahmer is the Chief Medical Officer for Vireo Health of New York. Let's hear it for Stephen Dahmer. And last but not least, we have Hillary Peckham, who's a Chief Operating Officer for Etain. And Hillary is actually the first person I met at the very first cannabis conference I ever attended. So, and one other thing, so this is also my one-year anniversary of being a certifying physician here in the state of New York, which I'm very proud of. So my first question, Hillary, so if we look back to the day that you actually got that notice and you won your license, I can only imagine how overjoyed you were. Take that time and think back to what did you anticipate this program would look like 1 year later? Compare that to where we actually are today, and share some thoughts on what you were hoping this program would look like a year later versus where we are today.
I guess when we originally started, we had no idea what we were getting ourselves involved with, but it's been a wonderful experience, especially for me working with my family. We're the only women-owned and only family-owned group here, so it's been wonderful. I would have liked to have seen the New York State Department of Health have opened up patient registration prior to requiring us to open up our doors, because one of the biggest challenges I think that we faced was, we were forced to open basically simultaneous with the first patient registering. And, you register and then you have to find a day off from work that you can go to the dispensary. And so you're talking weeks before many of us even saw our first patient, or, maybe you saw one the first week. We saw 25 patients in January, and it's millions of dollars to start up this company, and to basically just open to lose money was definitely a hardship for us. So that was something I wasn't necessarily anticipating, but we were ready for it. I think that ongoing problems with patients having difficulty getting registered, there not being a public list of physicians available for patients has been an ongoing problem that I'd like to see corrected, and I know Dr. MedPot has been a huge help already. It's a website to help patients get registered. And I think those are the kind of problems that personally, I struggle with, because we get the calls in our offices and we hear patients who are like, I can't find a doctor, what can I do? And I can't, as a registered organization, actually connect that specific individual who is suffering and clearly suffering on the phone to somebody that could help them. And that, I think, is sort of the most heartbreaking part of this program, is you see so many people that you can help and you want to do something for them, and regulation kind of prohibits you from doing that. So I've been really encouraged with the Department of Health opening up and possibly expanding to chronic pain, adding nurse practitioners and physician's assistants, and the movement that they're making to try and expand this program, I think, is really helpful.
A little bit about myself. I'm a family doctor that about a year and 4 months ago made a decision that I would enter into the cannabis industry, and at that time didn't know a lot about medical cannabis or marijuana in general. So I got to admit, I was a little naive as to where we would find ourselves a year later. I do have a background in integrative medicine, where we look at what's considered alternative or fringe or complementary medicine, and I knew that this would be a medical model, and there would be a lot of resistance from the medical community on anything that sits on the edge. And I knew that that would probably be our biggest obstacle. And a year later, I think we're still finding that it is. But it's just been an absolute pleasure. I gave up a clinical practice where I would take care of patients, and that was my passion in life. I utterly enjoyed, and I thought I would miss that. But it's absolutely tremendous to see the patients coming through the dispensaries with these severe diseases and being treated by medical cannabis, and really just the tremendous amount of relief. It's one patient after another, where these stories that I hear every day just fill me and get me up in the morning to do something that's illegal, right? And to risk my own medical license, because there are so many people, and like you said, that could benefit from this. We have a long way to go.
I agree with what Dr. Dahmer said, and the aspect that I've had a extremely overwhelming experience in terms of helping patients. Transitioning from a retail pharmacy world into a dispensary was a big change for me. I'm able to be more clinical in terms of the way I practice, and it's been really wonderful to see. I think it's going well, but obviously I think that the changes that the Department of Health are making to improve the program by adding more practitioners and adding more qualifying conditions definitely will help things.
You guys have all referenced some of the changes that are coming up in our New York State program. So I think the one that probably most people I think are excited about is the addition of chronic pain as a qualifying condition. Now, it's not guaranteed yet that this is going to happen, although most of us are really keeping our fingers crossed and praying for this. So please, Tricia, I'm going to hand the mic back to you, but share with us what that means to this program in this state, having this as an added condition.
I do think it will open up access to a lot more patients, and a lot more patients will have the ability. You don't have to have a specific ailment that causes your pain, and so it will just open up a lot of access. So I think that it'll be very beneficial for the program. We can't predict exactly, what it's going to do for us, but hopefully positive.
Yes, I hope so too. I mean, I can certainly share that it's very distressing when I'm seeing a patient, and several minutes into this visit, it becomes very apparent to me that the patient is suffering, the patient is sick, but the patient also does not have one of the qualifying conditions, and they're not going to walk out of my office with a certification. And unfortunately, there are so many conditions that could really help these patients live better, and chronic pain is probably the biggest one.